everyone. Welcome to our learning community, supporting healing after suicide for service members, veterans, and their families. Today is session 2 of 3 sessions, and we're going to be covering honoring and supporting suicide loss survivors through TAPS. Next slide, please. So I'm going to be the session moderator for today. My name is Chantal Boudreau. I'm a project associate with SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center at Policy Research Associates, or the SMVF TA Center. Next slide. So the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, and policies of SAMHSA or HHS. And our agenda is like our traditional, where we do our welcome, have our introduction overview. Then we're going to have, presentation, Q&A, discussion, more presentation, facilitated discussion, and we wrap up. So as always, we want to ensure a safe and inclusive environment. So please set your name to what you want to be called. We do ask that you disable any AI transcription or recording services and use the Zoom live transcription setting instead. Also, it's always nice if you have your video on, if you can, and definitely when you're having a discussion, it's nice to see who we're talking to. And obviously, please be courteous and mute your microphone if you are not speaking. And for communication, you can either type in the chat or use the raise your hand function. We can see on our end, like the number by which you raise your hand if you're the first, second, or third. So we do ask, just for the courtesy of everyone else, that you wait to be called on, and we'll call you in the order that you raise your hand. Next slide, please. So the learning community session objectives are to describe the TAPS model for long-term grief care, peer mentorship, and survivor support, to identify trauma-informed practices for supporting children, youth, and families, as well as to discuss ways to integrate TAPS resources and networks into community postvention systems. Next slide, please. So as we always do in any of these learning communities, we always love to know who is here with us. So if you can please take some time to put your name, agency, state, territory, or tribe you're affiliated with. It's always appreciated to see where you're coming from. Next slide, please. All right, so with that, I just want to say again, welcome to everybody here. Hopefully by now, people are starting to get settled, have their audio working for them as well. Next slide, please. So we did this in the last learning community, but again, just want to get a sense of where people are as far as whether they attended the last webinar. So did you attend the November 4th webinar on support after suicide loss postvention for service members, veterans, and their families? Yes, no, but I watched the recording for unsure. Just kind of helps give us an idea of where everybody is at. Okay, I see there are people still voting. All right, so there we have it. So about 60% of you saw the webinar, about 15% of you saw it as a recording, and then the rest either did not or they're not sure, which I understand it was November. That's a while ago. So thank you for filling that out. Oh. Next slide, please. So what everybody is really waiting for, the presenters. So we have today Dr. Carlos Stump-Patton, as well as Dr. Pamela Gabe here with us today. They are both from the Tragedy Assistance Program for Survivors with TAPS, and will be our presenters and sharing a bit with us. So with that, I'm going to hand it off to you two. Next slide, please.
Wonderful. Thank you, Chantel. I just wanted to make sure that I heard you correct, that you were turning it over to us. Yes?
Yes.
Great. Well, thank you so much for that warm welcome and for everybody joining in that chat and sharing a little bit about who you are and where you all are coming from. It's just great to see people across the country in different communities. And I know I speak on behalf of myself and Dr. Gabe that we are honored to be here. It's a great privilege to not only share more about what we do at TAPS, but how we hope that we can be a resource in the valuable work that you all are already doing in your communities. So we're going to get started and talk a little bit more about the program today. We'll go to the next slide. A quick review of the understanding. We want to talk more about the understanding around postvention interventions and some of the programs and services that we offer at TAPS, and hopefully support you in how you can deepen your own understanding in talking to bereaved survivors and loved ones, having kind of trauma-informed practices, and also how that carries over into homes and workplaces and community settings. And ideally, our goal is always about creating safety and promoting the aspect of healing and growth, particularly in this case, after loss and navigating the pathway along grief. So we'll go to the next slide and talk a little bit more about what that's going to look like. So we'll share some of our specific resources towards the end of the presentation, but if TAPS is new to you, we'd love to share just a little bit about who we are. We are a national nonprofit, so we are not funded by the government in any way, but we are our sole mission is supporting those after the loss of anybody within our military community, so the service member or the veteran, and we support all relationships to that. So beyond to the next of kin, that typically might be parents and spouses and children, but we support other relationships, aunts, uncles, cousins, grandparents, battle buddies, former spouses, fiancés. So we really fill a gap when many of those relationships might not be eligible for support services in other areas. Over 85% of our staff are also bereaved survivors ourselves, myself included as a bereaved military spouse, survivor of suicide. So we're really just honored to share more about the work that we do, being founded by a loss survivor, programs run by survivors for survivors. So we are very much a peer-based grief support organization. And I just wanted to give a minute over to Dr. Gabe. Did you want to say anything with your introduction before I go forward with any of the content? I'm sorry if I breezed over that quickly.
Oh, um, I'll go ahead and mention a couple
Okay.
things maybe when I start my slides.
Sure.
Thank
Okay,
you.
great. Thank you for that. So we'll talk a little bit more in the next slide about just kind of setting the tone. So when we are talking about topics such as suicide, it's very important to understand the best practices, particularly around trauma-informed care. And in this case, very much grief informed, suicide postvention informed, which if you think about some of the pillars, some of the things that we really want to make sure that we're upholding is creating very safe places, spaces built on trust and rapport, but always upholding this concept of safety. So whether it's even in the context of a presentation like this, whether it's in a one-on-one conversation, if it's in an in-person gathering, safety is always our utmost priority. And we do that really by starting by what you're doing here, being very informed around the population and the unique needs. So that is always around kind of capacity building of relationships. We want to always foster the sense of connection one-on-one within individuals, within support systems, within communities. So any way that we can really build upon those relationships is helping to contribute to that sense of connectedness. And then our other goal is to really kind of offer the sense of empowerment, particularly, in these cases after a loss when it can, feel overwhelmingly like so much is out of one's control. And feeling like they can gain some control back over their circumstances, their experiences, that they can have choice in their grief journey ahead that might involve learning new skills around emotional regulation and communication, and things that will just be very helpful to their grief experience. And we like to always take a moment in our own presentation here to set that groundwork for safety and acknowledge all of you. We might not know all of your personal stories or how you may have been impacted by suicide. We know that the majority of people are impacted in some way, shape, or form. And so we always like to set the tone with that if, in addition to the role that you might have in the role of a supporter or a helper, that you might have also been impacted personally by suicide. And if that is something that we talk about today that you might need individual support for, that Pamela and I, Dr. Gabe and I, and our organization at TAPS will stand ready to support you. We can do that one-on-one. We can do that through the being connected with us after the presentation. So just please know that we acknowledge that. So we'll go to the next slide and talk a little bit more now about just kind of a deeper understanding of suicide. We like to start out the training with this just to kind of remind everybody the focus area of what we're talking about today. But most people have a basic understanding around prevention efforts. This is really focused on reduction and protection against suicide. So very much upstream, very proactive, deepening our knowledge, education and awareness and trainings and, PSAs and things before a crisis emerges or somebody is in an emotional crisis or dealing with suicide. Intervention really refers to during or in the middle of a crisis. And, we often think of individuals who are much more likely to be responding to those crises, sometimes in very professional roles or emergency response roles and, ERs and clinicians. But we know that many times an intervention can happen in our community where people oftentimes are going to be much more likely to go to a family member, a friend, or a peer. So we all can play a part in those interventions. Even if we are not the individual for the long term, we can help get people connected to the care that they might need for after that intervention. But what we're focusing on today is really going to be around the concept of postvention, which refers to after the act. So it can be after a suicide attempt when we need to also do some post interventions, which could be a high risk time. For the purposes of today, we're going to be referring to the postvention after a suicide death. And so we often think of other people who might be very involved with postvention services. It could be victims advocates and counselors and clergy and chaplains and people in our faith community. But we also can all play a role in that. And sometimes that might be brief. It might be very specific. It could be long term. But we also like to highlight, particularly when we are talking about postvention, if you look at kind of our model there, how they're all very interrelated, that postvention in itself is highly preventative in nature. We're going to talk about a little bit more why that is. So much so that we really lead with the premise that it is critical for prevention efforts and it really needs to be included in any suicide prevention strategy. So we're going to just continue to the next slide and kind of go a little bit deeper into that. Before we do, we would love to just hear a little bit from all of you. And so we have some discussion questions, and you can either put that in the chat or use the raising hand feature. So we'd like to know first, in your community, which phase that is receiving the most attention? Is it really in kind of preventative or prevention efforts? Is it around interventions, or is it postvention responses? We'd love to hear if anybody has any thoughts or anything you'd like to share. And we're going to also get some help with Chantel in case we miss any questions coming in. Let's see, I'm seeing in the chat lots of, around prevention efforts. That's all three. That's always great to hear. Okay, that's some intervention. Wonderful. Great. what we're seeing in the chat is very close to what we usually see, a lot around prevention, more and more intervention, and postvention is really starting to become incorporated more. People are learning more about it. So it's really nice to see your different reactions and some that are saying all three. So that's always great. Wonderful. Okay, so next question. Where does postvention tend to either kind of fall through the cracks or maybe is missing or maybe misunderstood or needing, more attention? Any thoughts on that? Okay, I'm reading the chat. Let's see. We have a postvention team on site. Yeah, it's okay. So the long term is where it really might be falling short. The long term follow up. Oh, funding is a huge one. So some of the obstacles or areas where postvention is either kind of falling short or through the cracks and where the gaps are. The stigma. I I can't give the answers to the funding, but I feel confident that we're going to be able to address some of the issues around stigma today. So thank you. Thank you for the feedback around that. Okay, I'm going to go that's education. We definitely are going to cover that. So really kind of going deeper into what postvention is, why it is so necessary. Thank you. Thank you for that participation. All right. So for sake of time, I'm going to ask the next question, but you can keep the chat going. So who usually becomes responsible for postvention when a suicide occurs? And we acknowledge this could be very different, depending from organization to organization or your role, but we'd love to hear some experiences. Who usually is responsible for that? Okay, so I'm still looking at the chat that structures aren't in place yet for it really to be sustainable, and we need more understanding around the importance of that. Okay, so the suicide prevention team in some cases are responsible for the postvention responses. Yeah, oftentimes that will fall on the role of let's say like a suicide prevention coordinator. Yeah, I see a response there around families often need to initiate the ask, and I think we're going to address that too. How that in itself could be a challenge because sometimes when they're grieving deeply and not knowing where to turn, they might not even know that they are the ones that have to do the ask. So great, and I see vet centers being a vital part of that. Chaplains and MFLACs. Great. Thank you. Great responses. Okay. So let's see. I see one more. We have three persons, including included a chaplain that are trained in postvention. Wonderful. So I think we're hearing the themes of training, education, having multiple individuals who can help with that, meeting those demands. All right. Well, we're going to go to the next slide just for sake of time because we have a lot to get to, but thank you for that participation. So first, I just like to highlight the priorities around postvention. So if you already have training and you're doing this, some of this is going to be very familiar, but we always can have room to learn. So we want to think about postvention as being preventative, protective in nature, always coming back to that issue of safety, right? Of wanting to ensure safety guards there, that we are caring for all of those who are impacted. We're going to get to this as well, but we don't want to miss individuals who might have been impacted by a suicide loss, who might be in need of support. It can be very helpful in understanding the nature of suicide. This is an entire different training, but understanding theories behind suicide, the suicidal mind. And for some individuals who are grieving at certain points of time, understanding the complexity around suicide can be helpful in the grieving process to have a deeper understanding of perhaps some of the things that maybe their loved one might have been dealing with. It's very important to think about modeling, I say healthy, but really kind of adaptive coping skills and grieving for after a suicide loss, particularly when people are not sure. And so when they have others, such as peers who have had similar losses, it can offer some guidance and some hope through getting grief support and learning coping skills that it is possible to survive this loss. We always want to either identify risk factors and look for some of those invitations for survivors of suicide loss who themselves might be at risk, and making sure that they're getting referred to the care that they need. Let's see, we always want to think about help seeking behaviors, part of that modeling that healthy grieving and coping skills. So promoting help seeking behaviors, getting connected to resources will be vital. We always want to think about, when we think about safety, we're thinking about decreasing risk and then increasing safety and promoting healing and help seeking behaviors. And so having a model around that, customized around suicide loss and postvention, can help give people a little bit of a pathway on how to navigate this. So as we go forward into the next slide, we'll explain a little bit more about that. So when we think about those who are bereaved by suicide or impacted by suicide, we do know from research that there can be an increased risk for multiple things, for mental health concerns, substance use and addiction, and suicide for those who have had a suicide loss. I always like to caveat that, and it's actually the last point on this slide, but it's particularly higher risk when not offered postvention care. So in other words, when we can offer comprehensive and quality postvention care, we are dramatically reducing risk in a population that by the nature of their loss is substantially at higher risk. Okay, so some of the things that you might think about as either risk factors or any kind of indicators around suicide risk in general could be very similar to what bereaved loss survivors could be enduring, and some of the things that could place them at higher risk. There, I know there are just but a few here, but there are many, many more that we will get into in just a little bit. But some of the things that they might be, some of the needs that they might have that we can help to meet, that all are targeted at reducing some of that risk. So they might be needing a more of a professional or clinical level of care, connecting to peer supports. They might need, referrals for counseling with more of a trained professional, kind of understanding differences in grief responses, particularly in a family when people are grieving very differently and wondering, if one is effective and one is not affected, why there's not a wrong answer per se. So we always want to think about maybe comments or statements of concern if a suicide loss survivor is talking about something with themselves, maybe an inability to cope. That might be an invitation that we need to explore around maybe their own thoughts of suicide, particularly if they are sharing thoughts of suicide or having plans or expressing levels of intent. And now we might be getting into more of kind of interventions that might be needed with those who've been impacted by a suicide loss. So we're always thinking about safety. Okay, so we're going to go to the next slide and talk just briefly about how we have met this demand as an organization. Just for a historical overview quickly, we started building our department here almost 18 years ago. And since that time, this year will be our 18th annual National Military Suicide Survivor Seminar. As suicide loss survivors ourselves, some of whom we were clinicians in the field, working in the areas of grief, bereavement, trauma, and suicide, we recognized that particularly in our military community, we needed to have specialized programming to meet the very unique needs around suicide loss, because at TAPS we support around all causes of death. So what we're talking about here today is just one of those causes of death where we have had to meet that demand. But because we acknowledge that there was such a high risk level for our bereaved loved ones and family members, so we wanted to make sure not only we were supporting them in their loss, but we were doing things around prevention to reduce their potential risk. Our model now has been acknowledged, internationally. We've been invited by the Department of Veterans Affairs in Australia to come train them and teach them around the work that we have done and what we have learned from our own experiences, and what our survivors at TAPS have taught us over the years to be very helpful and effective in kind of stabilizing and helping them to heal after their loss. So we'll go to the next slide and we'll talk about a little bit very briefly, because this could be an entire training in itself, but I do want to touch on our model just so that you understand there is a framework with intention to help individuals after suicide loss. So it works essentially from the bottom up. It is meant to be very fluid, where people can visit in and out of different phases depending on what the needs that they are having. But primarily what we're going to focus around a lot today is stabilization. It is really the most, critical component, because whether it is in the first hours, days, weeks, we want to typically respond as quickly as we can, which helps to eliminate the time when people are isolated and alone with their loss. So in the stabilization phase, we are looking to try to connect immediately and address the most emergent issues that are needing care and attention around safety, around risk, and addressing the very unique concerns related to suicide loss. So I'm saying this in a very kind of idealistic way, not to imply that that you can fast forward and go through this fast. But ideally, when we can meet each phase with some of the needs, what we find is if we can connect to individuals, help them stabilize around the emergent issues at hand, it's much more likely that they could go into the work of grief, where they might be more likely to go to a counseling appointment and attend a support group, or perhaps in our case, come to TAPS events with other survivors, because we've been able to connect with them, have some of the needs, and assess what those needs are, that we can help connect them to the resources and the care that now they are able to process more of the natural feelings around their loss. And in time, when we have survivors who can kind of move through the model, so to speak, this is when we find that many of those individuals might come back, a year, 2, 3 years later, whenever that is, and say, I've been to the events, I connected to a counselor, I got, my family, we got some care for our trauma, I went to support groups, I've met other survivors like myself, I've done some of the hard work, and I'm at the point where I'm feeling a little bit like myself again. I feel like things have stabilized. I want to give back. And so this is when we see individuals making meaning around their loss, perhaps a newfound sense of a purpose for their own future ahead, this aspect of growth and healing after experiencing their loss. And so we know it to be possible because we are able to witness it every day. Many of those individuals will come back and say, I want to be a peer mentor with TAPS. I want to mentor new survivors like myself who have just had a loss, so that they know that they're not alone. And an example of this would be our own staff, who have kind of worked through this and have come and become a peer mentor, and then they become staff at TAPS. And like I said, over 85% of our staff are bereaved survivors. So we know it to be effective, and that's what we want to share with you today. So we'll go to the next slide. And some of those unique challenges that I mentioned, very, very unique and individual to suicide. We are not going to elaborate on all of them, but you'll see, just but a few here. Dr. Gabe is going to address, how do we talk to children about suicide? There can be a lot of challenges around, faith, within religion, within cultures where, there are a lot of differences and experiences. Of course, we talked in the chat earlier about the stigma, the shame, the silence, that the taboo historically that's been attached to suicide. It is changing. As a 30+ year suicide loss survivor, I can say it's changing. It takes a long time, but I can tell you it's all of us sharing our experiences that helps to really kind of change how we talk about that. There's a lot of complex emotions involved, oftentimes at the same time, that can be very overwhelming. The questions about, if only, would have, could have, should have, why, and the whys can, go on endlessly, and how it also can impact relationships, impact communities. And also how oftentimes the direct exposure to trauma, being physically exposed to trauma around a suicide, can be really debilitating. We're going to talk about that just a moment too. So if we can go to the next slide. We'll address that a little bit more in depth here. Again, we don't have the time to go into detail about it, but we do like to just kind of touch on the subject here that when we talk about suicide loss, there is more than just the grief. Oftentimes, this is a very traumatic loss. It can be unexpected. It can be very graphic in nature. And in our case, at TAPS within the military community, a large amount of suicide losses can happen in a residence, in the family home, family of a home of a friend, or in the barracks. What this means is that individuals who are exposed to this oftentimes are going to be loved ones, family members, friends. In addition to the grief and loss, they might be dealing with extensive trauma around either witnessing the death or finding the remains, or maybe perhaps having to perform life-saving measures. And so oftentimes the grief is addressed, but the trauma is overlooked. And in many cases, they might seem similar, but they really come from different things. And so grief in itself is a very natural reaction to loss. And, people, if you look, yes, they could have intrusive thoughts, and they might have disruptive sleep and nightmares and things that, with time and with support and with care and resources, that some of these things can stabilize. But with trauma, it's really rooted around the sense of compromised safety and fear and threat, and the same type of reactions. I don't like to say symptoms, but we'll say reactions can be much more debilitating. They can be prolonged. They can be much more invasive. They can be interruptive in individuals' lives, their daily activities of life, their quality of life, where they might be needing more or additional level of care. So let's go to the next slide. And for sake of time, I'm not going to elaborate on this, but here's just a couple of examples about what that might either look like if you are supporting somebody through observing. So, what it might sound like in a conversation, or how they might be presenting, or what they might be sharing that they're dealing with. And you can see how that could be really overwhelming, particularly if this is starting to layer upon layer, where they might be dealing with some trauma reactions in addition to their loss. And it's a pretty good indicator that we need to get some extra care involved. But the more we can do at the onset, we also could be reducing either the level of intensity around this, or that it could kind of grow into or manifest into something, more extreme. So we're always looking to think how we can reduce this. So let's go to the next slide. I'm keeping my eye on the time. Okay, a few more issues. I say issues of consideration. So when we think about that stabilization piece, there can be many challenges. Depends on the circumstances, which are very unique into each individual, each kind of case, each family. But many times, these are some of the things that we respond to very often. There can be investigations. Sometimes they are very lengthy. Sometimes, depending on who is responding, this might be immediately. This could be law enforcement. It could be casualty officers, depending on the circumstances. Sometimes it's handled very sensitively with a lot of care, and sometimes there can be trauma inflicted because people are maybe not informed around best practices. So there can be some struggles with that. Oftentimes, around suicide loss, either before a death or sometimes after, there can be information that comes to light. There can be secrets and information that now, in addition to the loss, family members and loved ones are maybe learning about their loved one. It could be around addiction, or gambling and finances, legal issues and court cases and things. In addition to having to grieve the loss, now there might be new information that they're having to process that can be very overwhelming. We know that, in our military culture, it's a large part of our identity. And when you lose a service member or veteran, that's another loss. So it could be the loss of our own community, the loss of a support network. So it's a change in our identity. So, the thought here is, in addition to the loss of the person, there can be a fallout of many other losses and challenges. How memorials are handled, how is it talked about or not talked about? And sometimes that might be important to an individual, or maybe they are wanting privacy, so that is very individualized, but it can be helpful just to be aware of that, perhaps as being a challenge, how that is handled in the media. Now that we have the aspect of social media, things can become public very quickly, and that can also be a time when rumors and gossip is perpetuated, perhaps unintentionally, or in the cases of either high profile um, cases or individuals, that might also gain more traction. And that's why issues around what we would call language and messaging will be very critical. Also, keep in mind around significant dates. So, when we talk about more of that long term postvention, it can be very difficult when there are significant dates. In this case, it might be the memorial date of a death, but it could be also dates such as Memorial Day or Veterans Day, special holidays, wedding anniversaries, birthdays, Mother's Day, Father's Day. So for those who you are supporting, just being sensitive to that, knowing that as the world is revolving for the person who's been impacted by a suicide loss, this could have real implications, and just the added consideration, the added care to acknowledge it. Not that you have to have the answers to this, but to acknowledge that that could be a challenge, could be very helpful to another person that you are supporting. Okay, let's go to the next slide. Just kind of check where we are here on time. Perfect. We're going to have another poll question for the group here. All right.
All right. Hello, everyone.
How confident do you feel using language that is supportive and non-stigmatizing, supporting families after suicide loss? Okay. Great to see some of those responses. And I just like to acknowledge that, it looks like almost half of you feel, it's almost tied, 47% feel very confident in using language that's supportive and non-stigmatizing. Good for you. And even those of us who feel confident, we can always learn more. And those that are somewhat confident, hopefully we're going to talk about that more today. And even those that who might have said, I try, but worry about saying the wrong thing. Thank you for being honest, because even if we might feel confident about one thing, typically around suicide loss, people do worry. I don't want to say the wrong thing. I don't want to hurt them. And you probably know a lot more than you give yourself credit for. And you're here. So that also says a lot. So thank you for all of you sharing some of your experiences. Hopefully today will just add to what you're already doing, and maybe add to some of those skills that you feel even more confident in having these conversations. And you always have Pamela and I, that anytime you want to practice, we're here too. Okay, let's see. We'll go to the next slide. Okay, so in that previous slide, we talked about the need for language, safe messaging. I'm not going to go into detail here. Again, it could be a whole other training, but our goal when we talk about safe messaging and language is always decreasing stigma. So what we just kind of talked about, right? So we want to always think about the bottom line. How can we decrease stigma? How can we decrease, the taboo? How can we break the silence and get people to talk about suicide? So there's a couple of examples here, kind of like what you would think of do's and don'ts and the whys. If you're in this conversation, you probably know a lot about this already, something I say as simple as, but it hasn't been simple. So instead of saying something like, committed suicide, we would say died by suicide. And there are reasons behind this. This is not just those of us who are, kind of being, over strict about language. This is based on what we know in the field of suicidology and research, that when we use safe language, it increases the likelihood that people will more than likely reach out for help, use the resources, much more likely to, call a crisis number or to reach out by text. And when it's done unsafe, it actually can increase risk, and it can even increase suicide rates. This is when you might notice the difference when now, which even 10 years ago, it didn't exist. Even on the VA has done a great job on, let's say, a prescription bottle. It might have the crisis line at the top. Or if you're reading a blog or an article, and at the very beginning, it might say, the following article has content around suicide. If you or someone you know is struggling with suicide, there's help. So we always want to instill messages of hope. We always want to include resources, and we're really promoting that help-seeking aspect, okay? So we have more resources on this at TAPS if that's something that you want to learn more about. We're happy to get some of those in your hands, but we're always trying to reduce judgment. We want to kind of avoid anything around shaming, judgmental statements, anything that might just kind of perpetuate that. So when in doubt, just take a minute and think about that. Less might be better. Just use the language that is just much more compassionate, the way we would with any other type of death, that we would have compassion for someone and try to have the understanding that, in any other public health, with any other public health concern, we wouldn't be doing it from the place of judgment and stigma. Okay, let's go to the next slide. I'm looking at the chat. Oh, yep, I'm seeing some great comments here. Yep, talking about the importance of safe language. Good. Okay, so when we talked about that unique concern that is specific to relationships, if you think about just within suicide loss, we know that what the research tells us is a minimum of 135 people could be impacted by that one loss. And so it's not just the spouse or the parents or the children, but it also could be siblings and grandparents and cousins, and it could be neighbors, friends. And in our community here, for service members, veterans, and military family members, it could be battle buddies and comrades. So it could be the veteran who lost a battle buddy, who might not view themselves as what we would say, a bereaved survivor, but they're grieving and they might have some of the same challenges. And this is something at TAPS that we try very hard to make sure that we are meeting the needs. Now, we can't cover all of these today, but what we're going to do is we're going to cover one around the unique needs around families with children. And as we do that, I want you to just think about how those same concepts really could apply to other populations. The concept might apply, but the context would just be slightly different. So we're going to give you an example, and Dr. Gabe is going to do that now and talk a little bit more about families with children and youth and adolescents.
Thank you so much. Thank you.
Absolutely.
Yes, and we can go to the next slide. And before I begin this section, I will just say briefly that I am the Director of Youth Programs at TAPS, and that is the department in TAPS where we support children and teens in their grief through our Good Grief camps, and we also have family camps. We do a lot of great things supporting children, teens, and their families through youth programs. And that would be not solely suicide loss, but any type of loss. Today, though, we'll be focusing, of course, on suicide bereavement. Before I go into that, though, I'd like to talk just for a moment about the experience of children and teens and young adults. So for children, their grief is influenced by a lot of different things, and I'll talk a little bit about that. The other thing, Carla noted the difference between grief and bereavement and trauma. And what I'll be talking about in these next few slides is really the experience of grief in kids. Certainly we support them if they are also exhibiting signs of trauma, and we support them in a lot of different ways, including referring them out. But grief for kids and teens is an absolute natural, normal reaction to someone dying. And each child or teen will have a very unique experience that could be very different than their siblings or other members of their family. So if you have 3 kids in a family, you probably have 3 completely different grief reactions. That's not unusual. And their grief is affected physically, emotionally, cognitively. They're impacted in all of these ways. Younger kids, it is normal for them to work through their grief through their play. It's not unusual to tell a younger child that someone has died. They will listen. They might not say much. And then they say, can I go outside and play? Or can I go do video games in my room? Without seeming to be affected. But it's not that they're not affected. It's just that it's overwhelming what they're hearing. And to cope with what they're hearing, they often just want to turn to play for comfort. Teens and adolescents, though, will turn more often to their peers for support. And again, not to say that they won't turn to some solo activities like video games, but they also do tend to turn more to their friends than younger kids. Okay. Next slide. And grief for kids and teens and young adults actually is impacted by the age that they are when the person died or they were, but also the age of the person who died. For children, it's not unusual for them to have a parent who dies who's young, a parent who might be in their later 20s or 30s is not unusual. The cause of death, and today we're talking specifically about suicide bereavement, and certainly the circumstances around the death, and after somebody has died by suicide, things can be very complicated. Sometimes when you compare it to other types of deaths, with things like secrecy and families withholding the truth, that impacts family dynamics and impacts the kids. And I'll actually talk quite a bit about telling the truth and the importance of that. Next slide. Additionally, when you think about children and teens, where they're at developmentally will impact their grief. So it's not just the age that they are, but it's really where they are in their growth, in their understanding. And what I have found with kids who've had somebody die by suicide, it's not unusual for them to appear older than their peers. It's not unusual for them to exhibit a different level of understanding about family relations and about people's behavior. And it's also not unusual for them to have an awareness that seems older than their years. One of the reasons for that in families where there's been a suicide death is that the circumstances leading up to the suicide death often are very complicated. There could be a lot of different things going on. It could be a mental health condition, depression or bipolar or PTSD that the service member is affected by. And the kids live through that with them and in the family before their person dies by suicide. And by the time their person has died by suicide, they might have gone through months or even years of seeing this other behavior, right? So that affects how they grieve. One of the other things that I've found with grieving kids is that they tend to be much more aware and sensitive to the needs of others. So one of the things we do when we're helping kids in a group setting or a good grief camp setting is we might have 12 or 14 kids in one group, and we're often asked, how do the kids get along, and how do you care for that many kids at a time with only a few adults without it being a behavior issue or anything like that. And it really harkens back to grieving kids being more sensitive to the pain of others, right? They're just much more aware. It's not unusual for them to look for ways to help others. Teens might want to volunteer their time, things like that. And one of the main things with their grief is that it is very, very fluid. It changes over time. It might look one way one day and very different the next, right? Okay, next slide. And then it's important for all of us who help grieving kids to understand that because of what they've gone through, right? They have just an overall different understanding about the world, what the world looks like, what safety means, right? So after somebody dies, we have shattered assumptions about our role in the world. And if we're a good person, only good things will happen to us. If you've had anybody die by suicide, you might have experienced this yourself. Kids and teens and young adults go through it as well. And they wonder about their place in the world after somebody dies by suicide. As they get older, as they grow and develop and learn more, they navigate their loss differently. They might look back and look at their part in the death, meaning did they know in advance that their person was struggling? Did they hear something that maybe they didn't share with a family member? And then sometimes kids and teens and young adults will think back and think maybe they could have done more. And I'll talk a little bit about what those different experiences are like for them. Additionally, milestones can be really hard. Birthdays, holidays, learning to drive, graduating from middle school or high school or college, certainly getting married. All of those milestones are hugely impacted when their person died by suicide. And part of that is because of the child or teen thinking that the person chose to leave or chose to die. Next slide. Another part of their unique experience is that they know that what they're going through is different from other kids, unless it's, of course, a child or teen who's been affected by suicide, but they actually don't want to be seen as different, right? They want to blend in, they want to fit in. Often they would rather that people don't know that this has happened to them. If they move to a new school, they might not want teachers to know. We find, though, that it is best for kids to be able to live a transparent life, right? And I'll talk about the importance in a moment of telling the truth. But in terms of other people knowing what has happened to them, they don't need to know all the details, but it is important that they're not hiding that somebody in their life died by suicide, because that adds and feeds into the stigma and the shame. Right. Sometimes kids are embarrassed that their person died by suicide. And one of the things that can help them the best is having conversations with them about it. And another thing that one of the reasons why peer support works so well is because kids can be in groups with other kids and hear that what they're feeling is normal and they're not alone. The other thing is kids and teens do not want to upset their parents or their caregivers with their own grief, so they might hide it. Interestingly enough, though, parents will also hide their grief because they think that the kids will worry about them. In families, children worry about their parents and parents absolutely worry about their children. We recommend open communication and talking about their feelings as much as they're able to, because again, that reduces the feelings of shame and stigma. As I mentioned at the beginning of this, it's not unusual, especially for younger kids, to act like nothing has happened, especially in the beginning. This is very normal. What we do is we encourage kids to ask questions as they have more questions and become more curious and are able to process what has happened. I'll talk a little bit about emotions in just a moment, so we can go on to the next slide. And then here's an important one. Private grief does not mean absent grief. Kids and teens will often not let anyone know how they're feeling. And partly because they're protecting others, like their parents, as I just said, but partly because they don't want invasive questions from others. One of the things that makes suicide bereavement and the experience of that different than other types of death is people think it's okay to ask invasive questions. Didn't you know that they were having suicidal thoughts? What happened? How exactly did they die? Right? They want to know all these details. And when you think about somebody dying from cancer, for example, most people aren't going to ask kids and teens a lot of invasive questions about them dying from cancer. They're not going to ask, well, how long did you know they had cancer? What treatments did they have? That's not the norm. But for some reason, with suicide death, people think they have a right to know. And one of the things that we help kids and teens and young adults with is saying, I don't want to share that, or I don't feel like talking right now. But part of the secrecy for them, it adds to their grief. So, next slide. Okay, we have some discussion questions, and I'll be looking in the chat here. When you think about some challenges that you face when supporting grieving children, what are some of those challenges? And I might have covered it already, and I might cover it again in a few moments, or cover it. Yeah, they don't know how to talk about the topic with them, and I'll give very specific details coming up. Yes, having what actual words do you use, right? Why is it so uncomfortable to talk about suicide? Because we often don't know the phrases or the sentences or the words. Not having the answers to their questions. Yes, I'll be talking about that as well. Um, and then meeting them where they are from different worlds. And so, for example, if you have kids who maybe are from a different culture, right? Or even different geographic locations, not understanding their experience that they might have gone through. Yes, as a parent or caregiver, being overwhelmed by your own grief. Absolutely. And it's important when you're overwhelmed by your own grief to, as much as you can, pull in other people who can help you. That might be family members, that might be friends, it could be, neighbors you're close with, people from the school. That part is crucial for you as a parent or caregiver to take care of yourself and get help for how to help your kids. Let's see. Yeah. Yeah. Kids hear things that adults are talking about. Sometimes adults either don't know they're there, or they're there and they're not realizing how much the kids are taking in and how hard that is for them. Yes. Um, Yes, yes. So a lot of this absolutely is focused around secrecy, right? And not knowing how to hide what we're feeling. But sometimes we want to hide what we're feeling after a suicide loss because we haven't worked out how we're feeling, again, due to guilt, due to blame, accountability, all of these emotions that come into play. Hey, thank you so much. Next question, how do schools or youth serving systems typically respond after a suicide loss? And let's see, I see one response here. Sometimes schools might over-respond. And you're welcome to, Lorraine, if you want to put in there what you deem would be an over-response, something that might overwhelm kids. And then while she's doing that, I'm going to go on to the next question in interest of time. What signs suggest a child or teen may need more support than they are receiving? Okay, sometimes I'll go back to the other question. Sometimes schools will offer one-on-one support. Yeah. Often what I've seen in schools, and I've been one of the people going into schools throughout my career, is I've seen more group related response where they're offering kids maybe support groups. But kids who are directly related, maybe a best friend of a student who died by suicide, or certainly if it was their parent or sibling, I can see them offering the one-on-one. Thank you for that response. And then in relation to that last question, what are some indicators for us? Changes in behaviors and routines? Absolutely. Might be withdrawn, right? Might have been an A student and now they're not wanting to do school at all. Anytime we see isolation, especially isolation that seems to come out of the blue, that's definitely a risk sign or a warning sign, or just a sign they need more support. And we're not necessarily talking about a sign of suicidal ideation. We're talking about what are some things they may be doing to indicate they need more support, right? Not talking to others can definitely indicate that. One of the things that I've seen is behavior problems that seem to come out of the blue. Maybe they're fighting more in school or fighting with siblings. That's always something to look at. Yeah. And then another question related to the second one is around honoring. So including or honoring kids who die by suicide. Every school is different and every school district or division has a different policy around that. What I've seen is they discourage out and out honoring of kids who died by suicide because they're worried about things like contagion. My recommendation for schools is to treat all deaths the same. And if you honor one child in a school by planting a tree, then do that with all kids who die and not, because that's another form of stigma. But that the schools should be consistent with their policy. And appreciate all these responses. Thank you. I'm going to go ahead and move on and you can continue to add to the chat.
I did respond to your question about what an over response might be.
Oh, yes. Okay. Thank you, Lauren.
And I actually come from a place of self-knowledge with that.
Mm-hmm. So if there are multiple people in the school system checking in with them, right, especially, so maybe a school counselor, maybe also a vice principal or a teacher, that can feel overwhelming. I would agree with that because they also have friends who are checking in with them, family members checking in with them. And as I mentioned in the beginning of this presentation, that they often want to hide from everything that's happening and they don't want those invasive questions, right? Because they are overwhelmed and feel overwhelmed. And a lot of that ties into the emotions on this slide. Of course, when we think about the reactions, we automatically think about shock and numbness and guilt. We think a lot about guilt. But some of the other emotions that come in, I mentioned before, it being embarrassed, a lot of shame, anxiety. They often wonder if one person died by suicide, that other people could also die by suicide in their life. So they get very fearful. The fear of being abandoned, again, because they've already been abandoned. And then the myriad of other emotions, of course, intense anger and sadness, disbelief that it happened, stress. There is so much stress involved, a lot of confusion, a lot of asking why, right? And one of the things that I will say about guilt that might surprise you, we don't recommend that you say to kids or adolescents, oh, you shouldn't feel guilty. Resist that urge. What we do recommend is that you say things like, can you tell me more about why you're feeling guilty? Or can you tell me more about what that's like for you? And the reason I point this out is think about a time in your life where you felt guilt. And especially if it's something as high stakes as somebody dying in your life. And if somebody well-meaning came along and said, oh, you shouldn't feel guilty, think about how that makes you feel. For many people, and kids and teens have reported this to me, it's one of the reasons why I know it, is they feel like they're not being heard and that their feelings are invalidated, right? We don't want to do that. We want to keep the door open. So with any of these emotions, rather than rushing to say you shouldn't feel that way, just say, can you tell me more about what that's like for you? And this is an example, by the way, of drawings that kids will do in groups, whether at a camp or in a grief support group. They're often very expressive around art, especially when given the opportunity to do it. Go next slide. They also get very frustrated by some things that people say that are well-meaning, but again, invalidates their grief or how they're feeling. Things like time heals all wounds, you'll see him or her again, they're watching over you, they're in a better place. discounts what they're feeling. And kids and teens, one of their first reactions are they are not in a better place. The better place is here with me now. Right. So that's another thing just to be aware of when you're supporting kids in your own life or that you work with. Um, we talked a little bit about invasive questions and how that can be really hurtful and they get very frustrated. They also are very hard on themselves and their reactions, right? They don't want to be as upset. They don't want to feel ashamed. They don't want to feel embarrassed. But a lot of these emotions just catch them by surprise, right? Yeah, next slide. Okay, here's another example I want to point out. This particular artwork was for many years I ran a center for grieving children in California. And this particular young girl, her dad died by suicide. And I'm not sure how well you can read the captions, but all of the adults have thought bubbles around the suicide and the loss. And then the dog has a speaking bubble. And even he's saying, oh, no, no, no. Okay. Art can be very therapeutic for kids and teens because it gives them a chance to take what they're feeling on the inside and pull it out and put it somewhere outside and be able to grapple with it. They can also share it with others, which again minimizes stigma. So this next section is probably my favorite area to talk about when I do trainings because a lot of people don't necessarily know this part or haven't been as informed about how important it is to tell kids the truth after a suicide death. I want to say before I say anything else, though, if you're a caregiver on here or a parent on here and you haven't yet told the truth or the full truth, or you waited to tell the truth because you didn't know that you should tell the truth right away, please do not feel bad. Know that you did the best that you could with the information you had. Sometimes well-meaning therapists or other mental health therapists might say, mental health professionals might say it's better they don't know the truth or they're too young. I will say, and again, this is 30 years of being in the childhood bereavement field, that kids of every age hearing the truth is important. And if the kids are too young to understand even what suicide is, it's still important that they're hearing the words. It does not mean to tell them graphic details. It does not mean to talk about the method of which they died. What we're talking about is using the term suicide or they took their own life. And again, I'll go into a little more detail in just a moment. The reason why this honesty is so important, a couple of things. First of all, kids will overhear things. If they know that they're not being told the truth, they'll often hide out around the corner. If dad died, mom might be in the kitchen on the phone with her sister, crying, talking about it, and the child is just simply hanging around the corner. Grieving adults aren't paying attention to what they're saying. Or, as one of our attendees here said, they'll talk about things right in front of the kids as if the child's not even there, right? If they're told the truth and allowed to ask questions and answer questions and have dialogue and conversation, then they're kept in the inner circle of knowledge and knowing. And that's the inner circle of truth, which is so important. That's where trust is. The other thing, and this is what I tell parents to help them really understand, is they're able to then grieve in real time with the rest of the family. If they're not told the truth in that first week or two, their grief is delayed. And by the time they know the truth, they're grieving differently than their family, right? Mm-hmm. It also can break trust. And as I said, allows or disallows them to ask questions, right? On this next slide, we'll talk a little bit more about what that looks like. And this again, whether you're in the role where you're supporting a family member or a parent, or you are a parent on the call, With telling kids the truth, it's important to sit them down in a quiet place without the TV, without distractions. Have all the kids together of all ages. So you might have a 3-year-old and you might also have a middle schooler and you might also have a teen. Have all the kids together, even though they'll understand different things you're saying. The reason that's important is you don't want to have the teens be the secret keepers, right? So we always say to parents, don't just tell the teens, because then they're withholding it from their younger siblings, which complicates their grief. It's also important for you to have that support with you where you don't feel like you're doing it alone. And start by asking the kids what they've heard, what do they know, and then tell them what happened in age-appropriate language. Okay, I'll give you some examples in just a moment. Answer their questions openly and honestly. And again, realize that if you have 3 or 4 kids in the family, they're all probably going to react differently. So be aware of that. And then we can go to the next couple of slides. I'm also paying attention to the time. Some of the best ways to discuss a suicide death is asking those questions, what they've heard, and then using real language. All of these sentences on here or phrases are all backed by best practices in our field. So for a younger child, you might say they made their body stop working and they died by suicide. And what does suicide mean? Suicide means you can say they ended their life, they took their own life, they killed themselves, right? And a child might say, does that mean they made themselves die? And the answer there is yes. Okay. This might surprise some of you on the call that we're being so direct, but this helps kids to cope using real language, real words. If you have a 3, 4, 5, 6, 7-year-old, they're too young to understand most of this, but it is important that they've heard the words, because as they grow, they won't wonder what that word is. Okay. If the child asks why, one of our participants mentioned how difficult that is if a child is asking why and we don't know the answers. Again, as the adult, be honest. If you don't know why, say, I don't know why. I'm not sure. I wish I knew more, or I wish I understood. Or it's okay also to say, I have some of the answers, and as I know more, I'll share more with you. It's also okay to say, some of the information that I'd like you to know, I'd like to wait until you're a little bit older. But please know that you can ask me anything, and I will answer it as honestly as I can. So if they're asking questions again around method or graphic details, say, it's in your best interest that I'm not going to discuss that with you. And it's good to have boundaries there, right? But just letting them know that their person died by suicide is very, very different than sharing the method or anything graphic. We can go to the next slide. Okay, so before we go on, let's see, I had a couple of people mentioning chasing sunsets on Facebook. Okay. And then somebody else said it's better to be direct and clear because kids will fill in the blanks. Absolutely. In fact, let me give you a story. I had 2 kids in a group, 2 siblings, and mom had died in the car from carbon monoxide poisoning. And this family did not have the means to get a new car, so they were still driving the same car. And dad had said mom died from suicide, and he had been honest about, that she had taken her own life, but no details. And when we were doing our opening circle, we invite the kids to go around and say their name and who died, and if they want to share like how they died. Again, not the method, but one little girl said, she was 7. She said, my mom died because she stabbed herself in the neck, and she was very graphic, like demonstrating that. And her brother said she died, she killed herself, but she didn't stab herself in the neck. And in reality, the mom had died by suicide, but it had not been a violent death in the way that her kids were thinking about it. And I understood the father's reasoning with the car and all of that. And that's something that he told the kids as they got older. But kids will absolutely imagine things sometimes far worse than what actually happened. Okay, thank you for that. And switching gears, these last couple of slides are really around coping and what helps kids to cope. So we've already talked about the importance of being able to express themselves, to be able to talk about what happened, to be able to ask questions and get their questions answered honestly. Being seen, heard, and validated in their grief and validated in who they are and how their grief has changed them, how they're different is important, right? Acknowledging they've been through a lot and you see them and all that they've been through. Certainly the support of friends and family, talking, texting, playing video games with others, doing activities where they feel a little bit of comfort, right? And so one of the things I do when I'm working with groups of kids and teens is I'll talk to them about what are some activities that you do that help you feel even a little bit of comfort. And some talk about listening to music or playing music, sports, but really it could be in any number of things where they are feeling comforted, helps them to cope. The other thing that really helps kids to cope is being with other kids. And so if you have any programs in addition to TAPS, where there's a program for kids who are grieving, anytime you can get them into peer support, it's invaluable. Okay, next slide. Okay, last couple of slides. I'll go through these a little quickly just in the interest of time. It's very important. Part of validating them is looking at their perspective, asking them, what's it like to be you, right? What are some things that have really affected you in your grief, right? Tell me what it's like to be you. Understanding their viewpoint. I'll talk to kids about perspective and I'll say, if you're in your house or your apartment or your condo and you're looking out the window out the front, what do you see? And they'll describe what they see. But if you go into your kitchen and look out that window, what do you see? And we'll just talk about how perspective is different individually and in families. They are also hugely supported, as we've talked about, from their friends. Often friends end up being different after a significant loss. So the friends that they had in the past might not continue to be their close friends, and there might be new friends that emerge who understand their loss, right? And we'll go to the next slide. And then some additional ways that you can support kids is by, number one, taking their viewpoint into consideration, being mindful about how different they are because of what they've gone through in their family and because of what they've experienced, what they've learned, right? Also, if you have 2 or 3 kids in a family, realizing that their grief is very, very different, okay? Meeting them where they are, asking how you can help and what they need is really important. And normalizing for them that feeling intense guilt is a normal part of it, or blame. Kids will often say, if they loved me, why did they leave me? And that's something to say, a lot of kids feel that way. And we don't have time today to go into the suicidal mind, but one of the things that I talk with kids about is, how we're not thinking clearly and rationally when people die by suicide. They're not in their right minds and ways of thinking. And pay attention to behavior. And even if it's unusual behavior, if they're not harming themselves or somebody else, it might just be their unique way of coping. Okay. Next slide. And then let's see, I've probably covered most of these. Providing choices is always really important. Certainly with planning the funeral or planning ways to remember them on holidays or birthdays, allowing them to choose activities is really empowering. and spending time talking and remembering, but on their terms. Right. Very important. I think I've covered the rest. Of course, be nurturing and accepting. That's so important. And somebody mentioned not having the words. That is one of the most difficult things, is not having the words after somebody dies by suicide. But listening and allowing kids to form their own thoughts around what happened can actually be more helpful than having the words yourself. Next slide. Okay, and this last slide is really talking about the family. And we began this presentation talking about TAPS and our prevention, intervention, and postvention model. And as you know, TAPS helps the entire family. And with our families, everyone does grieve completely differently in a lot of ways, but there are also some similarities that we find in families. Part of it is just realizing that roles change after the death, and everybody, it's almost like everybody's at a table, everybody gets up and moves a different seat. And one of the things that we do so well at TAPS is to help the entire family after this profound loss. Let's see, I think that might be the last slide. And yeah, and then just acknowledging that everyone grieves and copes so differently, right? So with that in mind, and when you're working with families or in your own families, think about different projects, activities, things that you can do together and separately where you're able to help each other. And also acknowledging, truly acknowledging that this is the hardest thing your family's ever been through. And, you're going to get through it together. Right, Carla.
Thank you for that. I think a segue just from that last slide, acknowledging that in our service member, veteran, and military family community, we are like a collective family, and just the way that families cope and individuals cope differently. We always try to just acknowledge even people on the peripheral that they might not see themselves as maybe a typical griever, or oftentimes they might not even think that they are deserving of support, but it is all of those in the community that could be impacted by that loss. So, it could be family friends who are very close to the service member who are grieving too, and those children might be needing support. Or as I mentioned, fellow service members or fellow veterans within the community that are impacted by that loss, and their family might be needing support. So we just always like to tell people that we extend that to anybody who is needing support. And thank you for all the thoughts around that, Pamela, and how hopefully some of those concepts can be applied and just kind of changing the context about difficult situations and how to talk about suicide. It can be difficult for adults to do those things. So if we can do that, starting with ourselves and learning that, it's going to help us have those conversations. So a couple of other things as we start to close out, as we mentioned earlier, we always want to also make sure that we're addressing the safe spaces. In this case, safety for families and spaces and homes. And not that it necessarily has to be a safe plan specific for suicide, but it could be a safe plan for times of stress and heightened emotions. And families that might have other family members or individuals, we just always want to make sure that we're sharing that resource. And SAMHSA has a wonderful resource. We have an example of that here, that anybody can take part and help with a safe plan, particularly with those who've been impacted by a loss. And again, navigating really difficult, emotions and stressful times, it can be really helpful. So think of that as another tool. If you're working with families that might have somebody who's either vulnerable or there's concern around safety, that this can a tool such as this can just give you some talking prompts and having those conversations and looking at those keeping people safe. Okay. And all of this, we're going to give you some links to get to that on our webpage. So if we go to the next slide, as we start to kind of round out our time here, we have a couple of QR codes. You can always find this on the website. We have that here as well. But we wanted to highlight that just so that you would know in our parting here today, some more resources that you can lean on. So we have the landing page rather, for our youth programs that Dr. Gabe spoke a lot about, our good grief camps, our family campouts, and all of our resources. We have our TAPS helpline. So that is available 24/7, and the numbers there, we're going to give you another slide in just a moment. But then we also have the landing page for anything related to the suicide content, whether it's prevention, intervention, and postvention that we talked about today. That you can find some of our one pagers and our PSAs. We have YouTube channels with videos. But one specific resource that we wanted to leave you with, we have the QR code for our guidebook From Grief to Growth. So it's Healing After a Suicide Loss. We wrote this, we published it, it's our resource, but it's very specific, written by survivors for survivors. Much of what we talked about today is in that guidebook. You can download that ebook for free. We share that in the community. So if you want to learn more, that can be really valuable. All the things that we talked about, including talking to children, we have chapters, and segments on that. So all of that is on that landing page that, through navigating that you can find. And the next slide, we just wanted to give you a little bit more of a quick review about some of the things that we stand ready to help with. So we mentioned a little bit about, who we serve, anybody in the military community who's, grieving the loss of a loved one. We have our 24/7 helpline. So that is run by us. It does not go to a call center. And, we are trained in crisis response, but we get calls from everything. If, somebody wants to make a donation, to they want to send a family our way, or somebody has an immediate loss, they need help immediately, we get you right into the system and start activating response and services. But you also might have a family member or, yourselves who might be grieving and it's 2 a.m. and you need to talk to somebody. We are there to listen. So think about us just in that regard. It's as a one stop. You can call our helpline, and from there we can get people routed to what they are needing, including those after hours around the grief and loss. We really want to be your go-to partner to help with that. We have a casework department. Anything that people might be navigating, from funerals to burials to resources to obtaining military documents. We've been down the road. We know what people need because we've been there. More than likely, if there's a question, our casework team is going to have a way to try to cut through, the bureaucracy and the red tape and get the help that's needed. I will say, specific with this population, one thing that we try to do in some cases, there might be a need, for example, for biohazard cleanup in a home after a suicide loss. That is something we don't want family members to have to be exposed to, but oftentimes they don't know that there could be help. TAPS tries to be a leader in that place. If we can find emergency funding to help with something like that, the quicker we know that, for example, you can contact us immediately on our helpline. We can start to mobilize some of those services. So that's just one example of how we try to be there to fill in the gap in communities, that we can be there to help you in doing the job that you're doing. So, we have our peer based support model. We do outreach with our peer team who, if we have a surviving spouse with children, we're going to get a surviving spouse with children, same cause of death, who's going to start doing outreach and calling and connecting. So we have a lot of resources that stand ready for you to use. And it's just going to really be dependent upon the circumstances and what the needs are. So just keep that in mind, so that as you go forward in the work that you're doing, that we can be one of those resources that you can lean on as really a trusted and vetted, safe partner, just to help you do the incredible work that you're already doing. And I think with that, we're going to kind of round it out to final questions. I know we're right about time. Okay, yes. So, Chantel, depending on our time, I'm going to turn that back to you, and you can kind of lead us towards the end here.
All right, thank you so much. Yeah, so we have not a whole lot of time for questions, so I think I'm going to close this out. But I wanted to say thank you before I lead into the other things. Just thank you so much for your presentations. I know I learned a lot even myself, and how to support within communities. And definitely I learned a ton on, as well on, how to work with children and youth, because I feel like that is something that I haven't really been exposed to a lot of knowledge there. So I appreciate it. And I can tell from the chat that others got a lot of really helpful information from that. We do have an optional homework that we always give to everyone if anyone is interested. The question is, if a child or teen in your community experienced a suicide loss, who would likely support them first? Who would support that caregiver? And where might support unintentionally stop too soon? So if you have time and you want to think about those things, kind of give yourself an idea of what can be done in your community, that's an optional homework. Next slide, please. So the third session of the series is going to be talking about building the foundations of postvention with lost teens. It will also be on Thursday from 2 to 3:30 p.m. and it will be on March 5th. Next slide, please. So thank you so much. And then there is our phone number as well as our email. If anybody has any, maybe some questions come up that you want to ask us about the presentation or just other questions in general. And thank you so much for those of you who stayed the extra minute. And I don't know, Dr. Gabe or Dr. Slimpatton, did you have anything you want to close us out with? And I'm kind of putting you on the spot.
No, thank you. I think just for sake of respecting everybody's time that we do, stand ready after this. So if it's something personal that we can help with, please you can reach out to our TAPS helpline. And if it's something specific around questions, if they reach out to you and your team, they can get connected to us. And we're happy to do a follow-up with a call or an email to help respond to more specific questions.
Yes. Thank you.
Thank you.